Thank you so much for the introduction. So I'm just going to give a quick overview of, what are some of the WHO recommendations when it comes to self-testing. And we also have a few example slides for you, which will give you an idea about what are some of the global advancements in self-testing that is happening and how we can adapt them for various programs across the globe. So HIV testing primarily is considered to be a key gateway as far as services to populations is concerned. And it actually is the entry point for a person to be reached and then move on into the cascade, whether it's for prevention, testing, treatment, and then continue providing services to this person as and when required. So WHO actually recommends a mix of testing strategies, which would include facility-based testing, which is mainly going to the facility, the traditional way of testing that we've been doing all these years. There's community-based testing, where we take the testing into the community based on the convenience of the community. We have provided assisted referral as well, where a healthcare provider helps the client to actually provide a referral for testing. We also have social network-based testing approaches, where we identify a high-risk person and then get into their unknown networks for testing more populations. And the last one is HIV self-testing, where we provide a self-testing kit to this person who wants to get tested at their own anonymity and confidentiality, and then we link them to further services. So what is self-testing? I'm sure a lot of people here know about this, but it's mainly when a person collects his or her specimen and then interprets the result himself. The HIV self-testing strategy by WHO has been, we have a small algorithm that we usually follow. We can use the self-test kit as a screening test, or also known as A0. And then if the A0 is positive, if the self-test is positive, then we need to link the person for further confirmatory testing at a standalone testing center or a facility-based testing, as is the protocol in your country. If the test is negative, then we sort of refer the client again for a retest, depending upon their behavior and their risk as well. So, when we talk of self-test, I think one term that really comes to my mind is self-care. It's very important for us to now move in the direction of self-care, where we are actually allowing people to take health in their own hands, right? We need to, teach people to take those decisions that they want to get tested and they want to get linked to any kind of service. And I think self-testing is a very important step that we need to take towards the whole self-care concept. Self-care is also extremely critical to the health system, because we've often heard that there is, the healthcare providers are burned down. There's a lot of burden in terms of number of people visiting the facilities. The peer workers are exhausted. Self-testing or self-care options actually provide us this opportunity to take that burden off from the healthcare providers, to let them focus on the more important things, and then we can let people do HIV self-testing just as a screening, or if they just want to keep testing themselves in terms of risk behavior assessment. Oops. I've skipped a slide. Okay. In terms of the self-testing policy timeline, I think we go way back to 1986, when the self-testing kit was first discussed. And then we move on onto the timeline where, you can see various things like HIV self-testing was first included in the guidelines in 2014-15. We had the first kit that got approved in 2008. And then WHO kept on revising the guidelines to make it more user-friendly, to make it more client-friendly, and also adapt newer approaches so that we can provide access to self-testing in a better way. So, if you see the WHO policy brief on self-testing, it just recommends a very simple thing. It says that self-testing, among the high-risk population who would otherwise not come to a facility for testing, should be offered HIV self-testing. So here I'm talking about clients who are more discreet, who are hidden, or who have been never tested before, who don't want to come to a facility or identify themselves. Self-testing should be used for that population. It might not be relevant for everyone, but definitely for people who can't come to a facility. HIV self-testing should be focused on a few things, like reaching the largest possible number of people who remain undiagnosed. So we saw that there is a huge first 95 gap that we still need to bridge, and this is exactly where we need to start introducing self-test kits so as to bring more and more people into services. Increasing the acceptability, equity, and demand by reaching those left behind, including key populations. And I'm not just going to talk about key populations here, I'm also going to stress on the fact that there are a lot of non-identifying populations now that we see. You know, people on social media or dating apps don't necessarily identify themselves as key populations, but they are vulnerable and in need of services, and that's the kind of population that we definitely need to reach. We need to ensure that there's cost effectiveness and therefore offer self-testing to people who are most at risk or who are not willing to come to the facility, rather than rolling it out for all clients who have been generally coming to a facility also. It helps us achieve the 95, 95, 95 goals, of course, and then of course facilitates linkage to treatment as well. So how do we begin? I mean, as a program, where do we begin? We always have this question of, you know, we've been a country where we've seen facility-based testing for decades. How do you change the whole algorithm, or how do you change the mindset of people to come and take a self-test kit for their home testing? So, you know, you can actually look at your epidemic in your country. You can look at the testing gap and actually prioritize a few populations. On the left side, I have a few populations that have been listed out. These might not be all, but these are some of the priority populations that we generally work with. You could also look at the various approaches that you can use to reach these people, and then also look at the considerations in terms of benefits that you might have as well. So just to give you a quick example, if you're looking at all key populations as your priority population, some of the approaches that you could use for self-testing could be community-based, which is outdoor outreach or door-to-door outreach. You could use the pharmacies and the kiosks. You could use internet and dating apps, vending machines, and many other approaches as well. Another example could be men. So men in general is now a priority population, and you could use these approaches, as we have been highlighted in green, to reach them through HIV self-testing. HIV self-testing is also widely used for case finding, so we can use it as in the facility. You can provide a self-test kit to a person who comes to a facility, who can then carry it for their spouse or partners. It could be used for key populations and other vulnerable populations, and also for secondary distribution like index testing or social network-based testing. It's also a very, very important part of prevention now. Self-testing has now been recommended by WHO for initiating or continuing PrEP as well. And a self-test kit can be used by someone who wants to start PrEP. So we initially used to ask the person to come to a facility to get a doctor consultation and then initiate PrEP, but all these things have now gone virtual. You can have a virtual doctor consultation, get a self-test home self-test kit, and then you can initiate yourself on PrEP based on the doctor's consultation. 2022, we also released a guidance on self-testing for PrEP. Like I mentioned, it's very easy to now just get a self-test kit online or at a facility and then initiate yourself or refill PrEP based on what your result is. So, there are different scenarios that have been described here. You can choose either. It can be either as prescribed every 3 months, it could be based on your needs, or it could just be as desired. There are a variety of support tools that are available for self-testing online on the WHO website, as well as many other websites in the form of videos, guidelines, guidance documents, tools, telephone hotlines. There are various examples and various tools that are available which will help you adapt self-testing in your country. Some of the latest HIV self-testing evidence by WHO, we've collected a lot of systematic review evidence, and it says that many distribution models would work depending upon the population that you want to reach and the context that you want to apply it to. Online and mail distribution, which is like virtual interventions where you just online order a kit, works very well and doubles actually the uptake of self-test kit amongst populations. It also increases the HIV testing frequency, actually doubles it as compared to standard testing methods. There is no difference in linkage to care when we say from once the person is screened for testing, there is no difference for linkage to care when the person has to be linked to confirmatory testing or thereafter to treatment. These are some additional results. I think they're very important. There are a lot of people who think that self-testing might be risky for countries to adapt because we wouldn't know what the result is of the person unless they report it back to us. And there might be a risk of suicide or depression or any anxiety and things like that. So whatever studies we've done so far, we haven't seen any reported suicides or any social harms. Social harms were rare, but suicides were none. No difference has been there in the uptake of any STI services, no difference in condom usage, and it has been very cost effective as well as empowering to the users. This is a quick snapshot of costs. I'm sure every country, every national program or every program is concerned about costs and budgets. This is a budget for HTS program and not just self-testing. Self-testing is just a screening test, but there are other tests that need to follow to confirm the diagnosis. And therefore, this gives you a range of an entire testing algorithm that a person needs to go through, which also includes personnel cost. There are 6 self-test kits that have been pre-qualified by WHO, which has 1 oral self-test kit and 5, 1 oral self-test kit and 5 blood-based test kits. The lowest that we have right now is a blood-based test kit, which is available for $1, which is the cheapest that we have right now, and which can be, which can be ordered or accessible in your country. Just to give you an overview of the national policy and implementation status of self-testing as per June 2022, 98 countries currently across the globe have self-testing policies, and 52 out of them routinely implement self-testing. If we see the bars on the left side, which shows you a snapshot of the Asia-Pacific numbers, I think we are still on the lower side. We still have a long way to go when it comes to HIV self-testing adaptation. Just 20% of our countries have adapted self-testing as part of their national program. Also to mention that Global Fund now has included HIV self-testing as a minimum program requirement. So all the countries that receive Global Fund grant cycle of funding would be including self-testing as part of their national program. Just a quick, I just wanted to take you through a little bit about virtual interventions as well, because it's a very important part when we are offering self-testing to people. It's extremely important that we go virtual. We need to capture the hidden and the discrete population that are available on social media platforms and dating apps. And majority of the population today use internet, and 4.62 billion people have access to social media itself. 2.5 hours on social media is being used. And it actually helps us to offer choices. It helps us to offer differentiated care and services to populations virtually, which actually helps us to improve access to services as well. We launched the policy brief on virtual interventions last year. WHO and UNAIDS launched this mainly to help countries understand what virtual interventions are and how do you adapt them for countries that you want to use. So this has a lot of information which can be accessible on the UNAIDS as well as the WHO website. It gives you a list of approaches, some implementation frameworks, examples. It also takes you through the costing ranges for virtual interventions. I think it's extremely useful for a country to go through this and adapt it. I have a few examples of what's happening on self-testing globally, and this is an example from Grindr, which is a gay dating app. They have now started distributing self-test kits on their app. So you can see, you can just order a self-test kit on Grindr, although this program is currently restricted to US, but it's being expanded to other countries as well. But this is just an innovation that I wanted to share with you to say that, it's so easy to access a self-test kit now that you can just order it on an app. There is also artificial intelligence that's come in a big way. This is an example from Audrey Health Pulse, which actually allows a person to download an app, and it allows you to interpret your results through artificial intelligence. This can be used by clients as well as healthcare providers, which removes the error of wrong interpretation of results, etc. Just an example of differentiated self-testing strategies in Vietnam. There are various ways of doing it. They have adapted a differentiated service approach where you give the choice to the person as to how they want to access the service, what exactly do they want to access, what kind of test they want to access, and where. Again, another important example from Vietnam, where there's a website that has been developed. You can order your test kit online. It just gets delivered to you through a courier service or a food delivery app, like any other parcel that might come to you, and you can report your result. Just wanted to bring your notice also to some information that we have now on PrEP users. So PrEP users, 95% of the PrEP users said that they used a self-test kit at home before they initiated or continued PrEP, and 96% of them said that they would use self-testing in the future as well for PrEP initiation or continuation. These are some results from the STAR Indonesia HIV self-testing results. It shows a very high percentage of kits that were distributed and a high percentage of people, which is 83%, which were first-time testers. These were people who were never tested before, and surely we obviously had missed them through our programs in the past. Some key lessons that I wanted to talk about. So self-testing is now the new normal. It needs to be included in your national program and give that choice to the person to be able to take a test home and do the test in their own confidentiality and anonymity. It's an affordable product, and it's important that we kind of find ways to get it or procure it in our country so as to expand case finding. We also need national policies and quality assured products. It's important to use WHO pre-qualified kits and also have policy guidelines on self-testing included in your national testing guidelines. It also ensures access to and the availability of affordable self-testing. And advocacy, as we all know, has always been one of the most important aspects whenever we are introducing any kind of innovation, and self-testing is no different. I think advocacy and involvement of key populations in that advocacy would play a very important role to expand the use of self-testing in our programs. Thank you very much. I would like to acknowledge everyone at WHO for these slides, and I'd be happy to take any questions later.